Let's talk about the Social Security Fairness Act that passed the House. Looks like it's going to pass the Senate if it already hasn't by the time I start talking about it here. And if it gets signed by the president, then it will be a reality. And unfortunately, I've talked about this several times. People don't understand it. The 3% of the people that this will affect, they will get extra money in their checks on a monthly basis. It will be paid by the 97% of the rest of the country. So this is the 3% of the country. We're talking about retired state and local government employees, police officers, firefighters, teachers, government, civil servants from state and local agencies throughout the country. 3% are going to be getting some extra money, and they completely disagree with that. I've talked about that several times. They don't want to believe the reality of the situation. Politicians are playing politics with this. I think they're trying to get these people to support them. Politicians are always trying to get votes. So this is a well-organized group that is pushing this, and it looks like they're finally successful. They've been trying to push this for a few decades, and it looks as like they've finally gotten their wish, and they have should get this approved. And let's talk about why it's completely unfair to the other 97%. And I know the 3%. I've talked about this several times. They just don't want to. They're either misinformed or politicians that are talking about it. If you see it on the news, they always say these 3%, oh my gosh, it's so terrible. They're reduced, their benefits are cut, they're being penalized for being civil servants and police and teachers and all the rest of it. But this is the Truth Channel here, and I'm going to talk about the reality. If you're new to my channel, my name is Ed Weir. I ran the third business Social Security office in the country. And in my semi-retirement, I'm making sure y'all get everything you are entitled to earn from Social Security, Medicare, retirement, spouse benefits, survivor benefits, Medicare, all the rest of it. This is also a live Q&A. So I've already seen a bunch of questions in there, and some people, I think the 3% have already jumped in there and says, Ed doesn't know what he's talking about. So, well, let's go through it. Okay, so what are we talking about here today? This is it looks like it's going to pass through Congress. It's called the Social Security Fairness Act. And yeah, typical, politicians, they name it something completely different than what it actually is. It's not fair to the 3%, nor is it fair to the other 97%. There's nothing fair about this particular act, but we'll get into there. It repeals what's called the windfall elimination provision or the government pension offset. About 2.7 million retired state and local employees will essentially be getting some extra money in their benefit amount in their check on their monthly check. And I'll get into the details of why this is completely unfair. And if this passes, I say the other 97%, we do the Social Security Fairness Act 2.0, and we demand the same deal these 3% get. Because right now, 97%, for example, out there, you're receiving about 50% replacement rate of what you paid into Social Security. These 3%, they're going to get 90%. Some of them are going to get up to 90%. Is that fair? That someone that paid into the system gets a 50% replacement rate, but someone that didn't, they paid into it, under side jobs or before they worked, but they get up to 90% for equal people. So we'll talk about exactly what all this is. And again, if you see it in the news, they talk about anytime they say the benefits are reduced or they're cut or these people are being penalized for double dipping, they're either the politicians or the representatives, or in the news, you see it all the time in the news. They just don't know what they're talking about. Frankly, they just don't know what they're talking about. All right. Is the current WEP and the GPO, this current law that they do the calculations, is it perfect? No. It should be changed, but it shouldn't be thrown out. They're basically they're throwing the baby out with the bathwater right now. These 3% should be recalculated the way it's recalculated now. I don't think it's fair in the terms of for some people. A majority it is, but there's some people in the lower levels that it should be calculated a little bit differently. And I'm going to tell you what the correct solution is. To throw it out is completely not fair at all. Okay, so let's go ahead and get into it. And I'm going to get a little bit into the numbers here. All right, so When you get your Social Security benefits, how Social Security calculates it is based on your high 35 years of earnings. So, number one, let me tell people out there, please check your earnings record. Remember the old letter they used to send out to once a year, and it says, "Hey, here's how much you paid in Social Security last year." Make sure you check that. Go into SSA.gov, set up a My Social Security account. Setting up a Social Security account is a good idea anyway because it prevents someone else from going there and pretending to be you and causing you trouble. So always set up a Social Security account, please. And then when you go in there, check your earnings record because that's how they determine how much money you're going to make for the rest of your life. You, your spouse, disability, surviving spouse, is based on how much you actually paid into Social Security. So if the numbers are incorrect, then guess what? You're going to get an incorrect benefit amount for the rest of your life. Okay, so here's how it works for 97% of us out there. This is called, again, I've done this a few 100,000 times. I've taken hundreds of thousands of retirement claims, disability claims, and this is what it looks like. This is the kind of the record. This is not the actual one. I kind of made it up. But it's called a SEQI, a summary earnings query. And so, for illustrative purposes, or as we used to say in the Marine Corps, for educational purposes only, this is kind of an easy way to do it here. All right. So, these are all your earnings since 1970. And how they calculate your benefits is they take your high 35 years of earnings. They don't take your last 5 or whatever. Your high 35 years, doesn't matter when it is. So if 1970, if that 1970 $2,000, you're like, well, it's definitely not higher than 52,000 or 53,000 now. No, that's probably actually higher because what they do is they take your averaged monthly earnings indexed. So that means they index that 1970s earnings to essentially today's dollars. So that $2,000 might be worth, $60,000 today. Okay, so that's automatic. They get your averaged indexed monthly earnings and they say, okay, throughout your life, you made on an average indexed for today's numbers, an average of about $5,000 a month or $2,000 a month or $7,000 a month. Okay. All right. So that's your AMI, your averaged index monthly earnings. And then the fun part starts is they do this calculation via bend points. And the bend points are progressive. So this is the thing that nobody understands. That I think the 3% understand it, but they don't want to understand it because they want some more money. But anyway, blue in my face talking about this, but I'm reaching out to the 97% that we need to stop this or we need more money as well. Okay, so let's say your averaged index monthly earning is $5,000. Okay, so what they do is they take the bend points, and these change a little bit every year. The percentages don't. So for the next year, for 2025, the first $1,226 they multiplied by 90%. From 1226 to 7,391, they multiply by 32%. Over that, they multiply by 15%. So if your averaged earnings throughout your life on a monthly basis is $5,000, they do those calculations there and they come up with 46%. You get a 46% replacement rate of what you paid into Social Security. You made $5,000, 46% of that is $2,311. That's your benefit amount at your full retirement age. Obviously, if you retire early, it's reduced. But if your average is 5,000, you're going to get a 46% replacement rate because that's how when Social Security started, it's supposed to replace earnings lost from retirement or later disability. So that's one of the reasons you get penalized if you are working when you file early because you're it's not replaced because you're concurrently working. But once you hit your full retirement age, you can make $1 billion a month and it doesn't matter anymore. Okay, so you notice these bend points are progressive. For low income wage earners, you get 90%. Middle, 32%, higher, 15%. So you see someone that makes $10,000 average throughout their life, they only get a 35% replacement rate. On the other end, if you only make $1,000 a month on average throughout your life, Congress, and I guess us, because we have had this system for decades and decades and decades, have decided, okay, if you only made $1,000 a month on average throughout your life, then you probably don't have anything set aside for retirement. You don't have a 401k, you don't have a pension, you probably don't have a lot of savings. You've had a hard life. So we have decided as a people that we're going to give you some extra money as compared to someone that $10,000. They probably got some, money stocked away there. So we're going to give you 90% return, a replacement rate. So if you made $1,000, we're going to give you $900. So, and because it's progressive, higher people gets less, lower income wage earners get more. And why is that? Because if we just, gave more money to the lower income wage earners, then the trust fund would run out sooner and everything like that. So Congress has decided, we as a people have decided to say, hey, if you're making big money, you're going to get 35%. And that 35, why are you not getting 90%? Because of what I just talked about. And you get less because we need that money to go to the low income wage earners. Okay. All right. So we're good there. The replacement rate. Now the issue comes in with these 3%, this act that looks like it's going to pass. Here's their earnings record. 3% of workers, we're talking state and local employees. The green area at the top is the same as ours. So this is their earnings throughout their life that they paid into Social Security. So most of these, if they're police officers, they worked at side gigs as security. If they were firefighters, they did side gigs or they worked somewhere else before they became a firefighter. If they're teachers, they worked in the summer doing something, and they did pay into Social Security. They are 100% entitled to get those Social Security benefits that they paid for. But the issue is, are they entitled to a higher percentage replacement rate? Because if you look at the top green area there, they got a bunch of zeros there, and they made $600 this year, and 5,000 this year, and 19,000. And you look at all those and like, wow, you were struggling throughout your life. You probably don't have a 401k, you don't have savings. You're probably on, receiving food stamps for a lot of those years because you weren't making any money. So, wow, sorry, we're going to take care of you. We will give you a 90% replacement rate because you were, really struggling throughout your life. The problem is, look at the earnings below, the non-covered earnings. And this is exactly what internally in MCS, the modernized claim system, the computer system in Social Security, not sure why they call it modernized. It's based on 1970s technologies, Fortran and COBOL. But anyway, I won't digress there. On the SEQI, the summary earnings query, the earnings, there's a line, and under there from 1983, because before 1983, local and state entities, governments didn't even have to report how much they paid into Social Security. So Social Security records are blank for those non-covered earnings before 1983. But since 1983, they have been reporting those. But look, this person right here was making, the same exact amount as that person there. Actually, a little bit more because they had a little side job or whatever the case may be. But Social Security computer system looks at this and gives them 90% replacement rate. Essentially a welfare type benefit, a benefit that was intended for low income wage earners. And how do I know that? I mean, this is not me talking. Go to Social Security website and type in the windfall elimination provision. And it says Congress passed the WEP for workers who receive non-covered pensions from receiving higher Social Security benefits as if they were long-time low-wage earners. So the WEP, the windfall, there's a windfall. They're getting extra benefits that weren't intended for them. And this is a provision to eliminate that windfall. And now Congress is going to just throw the baby out with the bathwater and give these people 90% or, some, 50%, 56%. But the idea is if someone says, no, I work for that, I earn that money. Okay. But did you earn that percentage? Are you entitled to that particular percentage? I always say, okay, if you think your check should be more, tell me what your AMI is with your current earnings that you paid into FICA, and then tell me how much your AMI is with your non-covered earnings in there. And if you add those two together, and this is actually how it should work. So Congress out there, Let me put my little alert here. Sarcasm alert. Congress, if you're watching, okay, if you're, it looks like it's already a done deal. You're going to throw away these. The Social Security Fairness Act is going to pass, and these people are going to get extra benefits. Okay, it's already too late. Sounds like, but you can do another law, and the other law, you understand, you pass laws, and you're in charge of the IRS. So you can ask the IRS, hey, tell us what these people's earnings were before 1983, and what you do is you add these two together. You add the yellow one and the green area together, and you come up with that person's Amy, their full Amy, their how much they earned on a monthly basis throughout their life. And then you take this little chart there, you can make your own little chart, and you put them on that chart and you say, okay, their entire life, throughout their life, they paid $5,000. Sure, $1,000, of that was, whatever, another part of it, but they made it $5,000. So therefore, they're entitled to 46% of what they paid into Social Security. And then you go in there and the top part, you multiply that times 46%, and they get a correct check. It's not rocket science. The reason this wasn't done before is because, again, Social Security didn't have those numbers because the state and local agencies weren't mandated to provide those numbers. But since 1983, they have. So now we have 41 years of those numbers, and we can do this, probably take you, 15 minutes, chat GPT, hey, run up a calculation of this, this, and this. And I'm sure chat GPT will run you a calculation and tell you how to figure out correctly. So these people don't get an extra benefit that we, the other 97%, have to pay for. So that's my 2 cents on that. So it looks like it's a done deal, but we need to redo the thing. And unfortunately, these 3% of employees are also being used as pawns for an attempt to privatize Social Security. And I am going to talk about that tomorrow. But for now, so this is a 40-year project to privatize Social Security, and everything is going to come to a head in the next 2 or 3 months. 40 years in preparation. The next 2 or 3 months are going to be the key to determine whether they're successful or not. So make sure you join me tomorrow on that one. Okay, let's go ahead and get into all of your questions. And if you think, Ed, you don't know what you're talking about, you're a completely idiot, yada, yada, yada. I was watching okay, fine. I'm an old Marine Corps sergeant. So yeah, some of y'all are pretty bad at personal attacks. I have to give a class on personal attacks as an old Marine Corps sergeant. But anyway, I was watching news, and they always had someone, coming in there, a teacher or something, and they say, "Oh yeah, my check is being cut." No, it's not being cut. You're just not getting the extra benefit. Or they have a firefighter coming in there and says, "Yeah, I got overpaid, and I've been dealing with this overpayment and stuff, and I know why they got overpaid is that." Happens all the time, unfortunately. When you start your Social Security benefits, when these 3% start their Social Security benefits, they're told at that time, once you start receiving that non-covered pension, that pension from your private, your public agency, you have to notify us. And what happens? They don't notify us because they don't notify Social Security. Again, I'm retired Social Security. I want to make sure I'm clear on that. But they don't notify Social Security because they want to keep their, their extra money. And so they don't notify. And then Social Security system eventually talks to the other system, and they say, hey, you were supposed to tell us, a year ago, 2 years ago, 3 years ago that you were receiving that pension. And they say, oh yeah, that's right, I forgot. And they're getting overpayments, and then they go on the news and they say, yeah, we got overpaid and we're trying to beat it and yada, yada, yada. So, yeah, so there we go. Let me see here. Let's get to the questions. I was given the choice way back when I started working to pay Social Security and FICA. I may have said no, but as I was not given that choice. Yeah, that's one of the things I agree with. Um, some people don't know when they're hired as teachers or something like that. They should. I mean, they should know that they don't pay into FICA because it shows right on their tax, right on their check that that part is not being taken out. So they should immediately question that. But yeah, some agencies out there are doing a great job in telling people that, hey, this is the reality of the future of your retirement. One thing it's interesting, these 3% of places out there, they don't pay into FICA Social Security, but they do pay into FICA Medicare. So for those people out there, I want to be fair to everybody. Those people out there that are not insured for Social Security because you did not pay into it enough because you work for these 3% of entities, um, you did pay into Medicare. So make sure you get your Medicare when you're eligible because you did pay into Medicare on those. Let's see here. I apologize, everyone. I started following Mr. Weir from his podcast on other channels and enjoyed his info, but this specific topic I feel is not properly stated and factually presented. Well, I you wrote that before I presented it, so so exactly. I've told this to people, and they say, "Wow," people just don't want to believe it. People want to believe what they want to believe and say. So. Thank you for your good service to the community. You're welcome. You're welcome. My sister-in-law retired in June. No work since. Social Security says she made too much dollars before retired. Now has to lose money to pay some back. Is there a penalty by retiring in the middle of the year? Okay, so um, this is probably what happened. The claim specialist in MCS, the same system, they put the non-service months in there incorrectly. And basically, what it is, let me start my other thing here. Basically, what it is if you retire, early retirement in mid-year, whatever, Social Security doesn't care about what you made before. So for next year, if you start your benefits, let's say in July, um, the first month you're under $1,950. The first year you can go to a monthly limit. So even if you make $1 billion before you start Social Security, doesn't matter. What matters is once you start your Social Security benefits. So for this year it's what 1860, for next year it's 1950. The first month you go under that and stay under that, then they don't look at what happens before. But possibly what happened with your sister-in-law, number one, thank you for looking out for your sister-in-law. That's what we do in this community here is we look out for other people. And so, share, subscribe, and like, and all that kind of good stuff. And that way this information goes out to more people. Take the information you learn and help your relatives and family and that little old lady down the street. Please, please, please. So, what your sister-in-law, if she retired in the middle of the year, and let's say this year, and she stayed under that monthly earnings limit the month she started her checks, and she stayed under that monthly limit for the rest of the year, then she doesn't have an overpayment. She's good. The problem is that claim specialists, Title II claim specialists, those are the people that take retirement claims at Social Security, they often mess up on the NSM screen, the non-service months. So if your sister-in-law retired in July, they're supposed to put XXXXXX from July all the way to December. So the money before isn't calculated, but they often put that wrong. So it's easy to fix. You just have her go down to Social Security Administration, and that's unfortunately one of the bad problems now. I'm going to talk about tomorrow is there's an attempt to destroy Social Security by destroying the customer service, and they're doing a great job there. But go down to Social Security and just have her provide that documentation that whatever money she went over, it was before she started her benefits. So again, if she made $1 billion before she started her benefits, doesn't matter. Social Security doesn't matter. So, all right. Do spousal or ex-spousal benefits affect the spouse's earnings amount? Are spouse benefits added to claim benefits, or is it just a higher amount of one? Okay. Spousal benefits, if you have a spouse or an ex-spouse or whatever the case may be, it does not affect your benefit amount at all. You could have 3 or 4 or 5, divorced ex-spouses receiving benefits, and it doesn't affect your benefit at all. If you are receiving benefits on your record and you want to file for spouse benefits or divorce spouse benefits or independently entitled divorce spouse benefits, everybody that watches my channel knows what that is. There are experts out there. I've got a great community of experts that are going throughout the country and helping other people. So we're doing an awesome job. So please join the community, like, subscribe, and all that good stuff. But if you have a spouse that you were married to for 10 years or longer, and that person is receiving benefits, or they're at least 62 years old, you've been divorced for 2 years, if that's the case, if it's just they haven't filed for benefits, their benefits amount have to be twice your benefit amount. So let's say your ex-spouse is receiving $1,000. Their full benefit amount is $1,000, and yours is 400. So yours is less than half. So if at your full retirement age, you can continue to get your $400 plus you get an extra $100 from their record because half of 1,000 is $500. And again, it doesn't affect their record whatsoever. And one of the things that a lot of people are making a mistake is that they they do the calculations themselves. They look at their spouse or they call their old spouse and say, "Hey, how much are you making?" And he says, "Oh, I'm making $1,200." And it's, "Okay, I'm making $600." "Okay, I guess it's not less than half of the other one." No, don't look at those numbers. That person looked at the check and you looked at your check. That's called the MBA, the monthly benefit amount. You don't look at that. You have to look at the PIA, the primary insurance amount. That's the benefit you would have received at your full retirement age. Those are the numbers the Social Security looks at to determine whether the benefits are available for a spouse. And another thing that Social Security is making a mistake at is they're not finishing their sentences. We did a lot of training in my office to make sure we provided good information. I would argue that my employees were the most trained in the country. Um, I'm not going to argue. I'm going to tell you it's a fact. Anyway, um, but when you call up Social Security and you say, "Hey, I want to see if I'm eligible for any spouse benefits or divorce spouse benefits. I want to see if one benefit amount is less than half the other." And if they say no, you're not entitled to spouse benefits. And then they say, "Okay, all right, thanks, bye." No, 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 no. What they should say, you're not entitled to spouse benefits right now because your benefit is more than half of the other person. However, that other benefit is higher. If anything should happen to that person, because survivor benefits is not 50%, it's up to 100%. So if anything should happen to that person, then you will be entitled. I know there's a lot of people out there, millions and millions of dollars being lost because some, someone in their 70s or 80s or something, had a spouse that they were married to, and they're entitled to benefits, but you ask them and says, "Hey, weren't you married to that person for at least 10 years? And why didn't you get benefits?" "Well, I called a few years ago and they said I'm not entitled to benefits." "Well, wasn't that person alive when you called?" "Yeah, yeah." "Haven't they since deceased?" "Yeah." "Well, call again, please. You might be entitled to benefits." So will there be another government shutdown? They shouldn't get paid if they do. This is getting ridiculous. Yes, this is getting ridiculous. And I've been through several government shutdowns when I was at Social Security, and even when I was in the Marine Corps in the 80s. For Social Security is considered essential services. So for most situations, you can do everything. You can file a retirement claim or disability claim, or get a check and stuff like that. There's some things that the local Social Security offices are not allowed to do during that time is issue earnings queries for people that need them for background checks, new Social Security cards and stuff like that, unless you have some type of dire need or you need it for a job or something like that. But most times, if you need a new Social Security card, not a new number, but just a new Social Security card because you lost yours, washed yours, or whatever the case may be, you can do that online now. Just go into ssa.gov and you can do it online. So let's see here. But again, I'm going to talk about this tomorrow. This has been a 40-year effort to destroy Social Security through many different means. And one of those is to just kill customer service. So you all get completely frustrated with the entire system and say, these guys suck. And they're just give it to Wall Street. And then the politicians win because that was their plan the entire time. So anyway, let's see here. I paid in penalized 75%. Again, it's not a penalty. It's just a recalculation of your benefit. So if anybody ever says a reduction, I got cut, I got penalized, no, you just did not get the extra benefits. And you should be aware of this because every time you got that statement that says, "Hey, here's your benefit amount if you wait till your full retirement age," right under that, now there's a whole page that says, "Unless you're receiving a non-covered pension." So yeah, ignorance of the law is never an excuse because it's written right on there. This is not your benefit amount. It never was because you're receiving that. So, all right, Rebecca, my husband did not receive but 5 years of Social Security. I always thought I could get his because although I do have a state pension, I did pay into Social Security. Yeah, so you're talking about the government pension offset. So the same type of situation happens if you get a government pension offset. The windfall elimination provision is the recalculation of benefits on your own record. The government pension offset is that your non-covered pension offset what you would receive from your spouse or deceased spouse. And that's also being repealed. And everybody, the 97% of people that paid into Social Security, for the most part, their Social Security offsets what they receive from their spouse or or divorced spouse or surviving spouse. So it's okay for the offset for the 97%, but not so. Yeah, again. Let's see here. Your podcasts are so biased. Yeah, I okay. Yeah, to the truth, I would argue. If you have an argument to the contrary, please, rather than just say, "Yeah, you're biased," give me a little bit more context. Tell me what I'm biased about. Okay, I had full benefits because. Oh, okay, that's another question. Let's see here. Okay, someone says I talk too much. Well, it's what I do. I sit here and stare at the camera, and so. Call your senators reps about the FICA cap. Oh, yes, yes. This is, I'm going to talk about this tomorrow, but yes, the FICA cap. I've got petitions on there. I've got a couple of petitions you can see in the chat, and I'll put them down in the description of this video as well. It's basically petition number one to support your local Social Security offices so they can do their job. You know, take your retirement claims and move away from this reservation only system that they've moved to, that they were forced to move to, and file, do disability claims and not mess stuff up and have enough staff to do the right thing. And the other petition is to raise the FICA cap. And what that means is, for the new people out there, basically one of the problems of one of the main reasons Social Security is having an issue going forward, and it's going to get worse. The estimates are that once they pass this Social Security Fairness Act, that's going to make more cuts for everybody. And those cuts are going to happen sooner. They've estimated about 6 months earlier, so that the cuts are going to be instituted. And so I think they, need to, anyway, I guess it's a done deal. The horse has left the stables. But one of the solutions to make sure we don't get those cuts here in a few years is to raise the FICA cap. Right now, everybody that pays into Social Security pays FICA, Social Security, the 6.2%, and then your employer pays 6.2% on everything up to $176,100. $176,100. That's for 2025. It changes a little bit every year. After that, you no longer pay Social Security FICA tax anymore. So you're tax free after that. So I would argue that everybody pay, since 99% of us pay FICA tax on every dollar we earn. Shouldn't everybody? And if that happened, then Social Security would be good for many decades to come, and we wouldn't have to have cuts or raise the retirement age or anything like that. But I guess the billionaires in charge don't necessarily want to raise that because they're going to have to pay FICA themselves, like we have been. So there's that. But we can always try, right? All right. Ed, do you know if they eliminated spouse benefits for any of the 3% that get any of this benefit? I read they were pushing to have for earners only, non-spouses. Yeah, there is not the 3%. We're talking across the board, 100%. There was again, there's a lot of proposals out there. If you look in the comments in my description down below, I have the chief actuary of the Social Security Administration. He runs the numbers. Anytime some politician has some, harebrained idea, hey, I know how to solve Social Security and make sure we don't get cuts here in the future, we should do this. And then the actuary pulls out his calculator and he does a calculation and says, oh, okay, that's an idea. It'll only solve 2% of the problem. And then all of those solutions, those ideas are in the description under the chief actuary report there. And the one I advocate, that solves 73% of the issue. So, and if you look at the comments, if you've been following this channel for any time, pretty much everybody that follows agrees that the FICA cap should be increased. All right. Social Security earnings report has a year that is blank, no earnings. Why would that be? Should probably ask the IRS, but I don't really want to poke that bear. Thanks for all you do. All right. So I would reach out to Social Security if you have a gap year, like in 1982, you know you worked, but it says zero. Then the first place I would check is it's called the suspense file. So internally in Social Security, they have a file of earnings that have not been assigned to a particular person because maybe, you or your accountant or somewhere along the line, typed in the Social Security number wrong. You typed in 1 2 instead of 2 1 or whatever the case may be. Your employer did it, and those earnings are just out there in limbo in a suspense. So I would reach out to Social Security and say, hey, in 1982, I show a zero, but I work for the same company the year before and the year after. And what the Social Security employee will do is look at the suspense file, or actually, they will look at your record first, your CQI, actually your DQI. The CQI is just that summary, but the DQI is the detailed earnings query. And in the detailed earnings query, it'll have 1981, you work for this particular company, and here's the EIN, the employer identification number for that particular company. And then they take that EIN, the company, the employer identification number, and they look at the suspense file for 1982, that gap year, and they say, oh, for this employer, oh yeah, here's $47,000, and it has your name on it. Oh, they just typed the Social Security number in wrong, and they fix it and they bring it down. They stick it in your record. And if you're already the great part about it, if you're already receiving Social Security benefits, if you've been receiving Social Security benefits for the past 10 years, and they add that missing year in there, they will recalculate your benefits for the past 10 years. So if you're entitled to $5 more because of that, then you're going to get $5 for 10 years. So that's a beautiful thing. They'll fix it for you. So that's the first place I would try. And if that doesn't happen, then yeah, you'll have to reach out to the IRS and see if you can get some type of proof that you actually paid into it, and then provide that to Social Security. So, all right. Let's see. I just got an ad for a free casket if I sign up for an event. Oh my gosh. Yeah, Medicare, CMS, the Center for Medicare and Medicaid Services, is supposed to be stopping some of this really bad advertising. The big ones are the ones about those grocery cards, that you set up for Medicare Advantage and you get, $1,000 grocery card every month and free ice cream and unicorns. It's awesome. Call us. And then you call them and they say, well, it's only available in one zip code in, West Virginia. And but then they got you on the line, they got your phone number, and they harass you forever. So they shouldn't do that. Do those grocery cards exist? Do the free casket I've never seen that one before, but yeah, they're supposed to be stopping that. Yeah, but there's still bad actors out there, unfortunately. So that's why I partnered up with Chapter. If you don't call them, they ain't calling you. So if you need help, I just had Thomas from Chapter on there yesterday talking about the different enrollment periods. There's another one coming in January, February, March. If you need help with Medicare supplements, Advantage, and all that kind of good stuff, yeah, reach out to them and they'll help you out. Sorry, but being penalized for working in public service is not fair. Okay, there's an argument. What about the 97% of public service employees, the police, the firefighters, the teachers, the other 97% that are not receiving that extra replacement rate that you are? What about them? So there's that argument. No one else is being penalized. Again, nobody else is getting that extra benefit that was intended for low income wage earners. So there's that. Let's see. Ed, haven't seen a doctor in 10 years. Might be why I didn't know. Oh, well, you're seeing a doctor now, but I'm not a medical doctor. So anyway, let's see here. As an American widowed woman who taught for 35 years and affected by both laws, I want my survivor benefits. Again, everybody else that receives benefits on their own record that paid into Social Security, their Social Security amount offsets what they would receive from their surviving spouse benefit. So if you the other 97%, if they are receiving $800 a month from their own record and they're entitled to $1,000 from their deceased spouse, they will continue to receive their $800 and they'll only receive $200 for a total of $1,000. So why is it okay to offset the 97%, but you are given an exception? So there's that. Let's see here. Thank you, Ed, for the explanation with visuals for those who need it. Stop calling this expert a liar. Thank you. Yeah. It yeah doesn't hurt me, but anyway. Again, they've been kind of when you have that same idea that you're being ripped off for decades, then nobody's going to tell you different. So that's just the way it is. So come on, all discussion is a good thing. All have the right to say what they feel. Yes. Okay, let's see. Turn 65 December 22nd. Sign up for supplement in October to start December 1st. Received a card today. Someone called today on behalf of supplement insurance with some important health related questions. Have not used insurance. Okay. So, one of the things I got to warn people out there, if 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 you sign up for a Medicare supplement plan, which I always recommend, if you're turning 65 or you're new to Medicare Part B and you want to go ahead and sign up for, you sign up for Part A and Part B and you want to cover all the gaps by getting a Medicare supplement plan, a Medicare Advantage plan, a Part D plan, always, 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 please start with a Medicare supplement plan, the Plan N or Plan G. I prefer Plan N because I'm cheap like that, but either one, it depends on your particular situation. Check out those first. Have you ever you're helping out, a chapter or your cousin or nephew that helps with Medicare Advantage or Medicare plans. Tell them, don't talk to me about Medicare Advantage. Talk to me about Medicare supplements, and then they'll talk to you about Medicare supplements. And then if it's right for you, that's the one you do. If it's not, then you go down to Medicare Advantage. But to your question, um, most of the companies that provide Medicare supplement plans also provide Medicare Advantage plans. And because you have a Medicare supplement plan, you have a standalone Part D prescription drug plan from probably a different company. And that company also does Medicare Advantage plans. So because you have you're their client, their customer, they're allowed to contact you, and they will contact you and contact you and contact you and try to get you to switch from a Medicare supplement to a Medicare Advantage plan by telling you, "Oh, yeah, we've got this new plan in your area. It gets extra dental and vision and gym membership and free ice cream and unicorns. And why don't you switch to that? Because all of these health insurance companies make more money when you sign up for a Medicare Advantage plan. They make less money when you do a Medicare supplement plan. And so they're always going to try to switch you to a Medicare Advantage. Please avoid it if at all possible. If eventually you can no longer afford a Medicare supplement plan because there is a monthly premium, then it is what it is. But avoid switching as long as you possibly can. So, all right. I am 64. I made $9,000 above the earnings limit. I have two autistic sons also receiving benefits on my record. Social Security told me that all three of our checks will be reduced 10% each until paid back. Is that correct? Yes. If you go over and the yours is suspended and you're living in the same household and everything, then yes, all the other benefits will be suspended because you went over those particular months and all other, yes. But because Anderson Cooper did an awesome job in his 60 Minutes episode on overpayments. It's easy to set up an overpayment now. You can do it up to 6 years, 5 years, 60 months, and set up a monthly payment plan and have your benefits restarted there and just, a little bit every month. So yes, unfortunately, yes. All right, let's see here. Yeah, a lot of people aren't happy with the information I provide, but I knew that was going to happen. I'm not speaking to the 3%. I've done a ton of videos explaining it to the 3%, and they just don't want to. Yeah, they don't want to anyway. I try to be a pseudo mod when I am able to catch the live stream. Unfortunately, I'm not able to actually be a full time mod. Yeah, Take and Took is one of our best members of the community that goes out there and helps people. And yes, so we've got some great people. Raise the minimum wage to a thriving wage and tie it to inflation with a COLA, then more payroll tax will be collected. Yeah, it's Xeno or the Destroyer. Yes, that is one of the reasons why that FICA cap in the early 1980s, 90% of wages paid into Social Security. But now, because of stagflation, the median wage earner in this country has pretty much been flat since the 1980s, but the people that have been making money have been making, I mean, phenomenal amount of money. And that money, that phenomenal amount of money, doesn't pay into Social Security, the Social Security FICA, and that's why we're going to have cuts in the future. If we got that money, the regular workers, if we had received that money, then we would have paid into FICA 6.2% and all that kind of stuff, and then Social Security would be good for a long, 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 long time. But unfortunately, too much of the money is going outside of the purview of Social Security FICA tax. So yeah, it's unfortunately. All right. If a bill is put to the floor, we all should go on a national economic strike. It's already been put to the floor. It's already been done. Oh, you're talking about the. Okay, you're talking about the. Yeah, the stagnation and all that stuff. Yes. Yeah. Dun, 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 let's see. I'm going to just kind of skip over some of the those three percenters, I guess, and we will get to questions to see if we are going to help you out. There are not going to be any changes to Social Security or any other social safety net with this group of incoming billionaires and their minions in lockstep. Cuts are already on the table. Um, I've always been very, very optimistic, and people have asked me for decades, when should I retire? Should I start at 62 or 65 or 67? I've always said, hey, do you need the money? Are you working? Are you healthy? Longevity in the family, so you could put you in a higher tax bracket. But recently I've added one more, is about the future cuts that are happening. Do you want to get it while the getting's good before the cuts happen? Because the cuts right now is, if nothing happens, nothing, no changes. Well, there already is change. So they're looking at cuts in 2034 by 21%. Now it's going to be 6 months earlier because they're going to pass this, and it's probably going to be 22 or 23%. So because they're passing this, they're giving the extra money to the those 3%. I'm going to have to change that now once that passes. But if the next president gets some of the things he's talking about, not taxing Social Security, which I think is a great idea, but that's also going to cut into the trust fund, and the trust fund is going to run out earlier, and we're going to get more cuts. So 20, 31, 33%. If we actually do something and make our politicians do something, then there'll be zero cuts. So I guess it's you all have to choose. You have to vote and reach out to your politicians and tell them to actually fix it rather than kicking can down the road. And again, I'll talk about that tomorrow. Yes. All right. Let's see here. All right. So people said the money is stolen. Um, okay, let's see here. Get some new people. Um, wow, I feel I'm going to be cheated big time. Single mom, put myself through college, working hard, so unfair. Sorry for the rant. I'm eligible for retirement 4 years. Yeah, in terms of the cuts, yeah, we definitely need to reach out to them and yeah, make sure this doesn't happen. Social Security been around here since 1935, and yeah, we definitely need to get it fixed. It's so easy. I've got the again the actuary report in the description. Go to your local grade school and tell them to fix Social Security. Add this number and this number together, and you've got a solution. Done. 10 minutes. Easy. Ed, can I file for divorced spousal benefits if I am receiving spousal support? Yes, if you're receiving some type of spousal alimony or something like that, yeah, zero relevance on Social Security. So, yes, if you're entitled to benefits on that person's record, and so in order to be eligible for benefits on that record, you have to have been married to the person, because I assume the person's still alive and kicking and you were divorced. So you had to be married to the person for 10 years or longer, and you're not married right now, and you're already receiving benefits on your own record. You have to start benefits on your own record. Okay. Then you can receive benefits on that person's record if their full benefit amount is twice yours. The independently entitled divorced spouse thing, that is, there's a lot of people out there that are just sitting around twiddling their thumbs and say, yes, I'm entitled to more money from my ex-spouse, but that person hasn't filed for benefits yet, and therefore I can't get it. Unfortunately, Social Security employees are telling people that, which is 100% incorrect. As long as that person is 62 and you have been divorced from that person for 2 years, you're eligible to receive benefits on that person's record. They don't have to be receiving benefits. It's called independently entitled divorce spouse benefits. Again, like, subscribe, share, because there's people out there that need that money that are just sitting around and waiting for their ex to file for benefits when they don't have to. So I was full retirement age May 2024. I just applied a week ago. If I start in April 2025, will the amount be more than starting in January? Yes, absolutely. If you're your full retirement age, actually, because after your full retirement age, they can give you 6 months retroactivity. So if you just applied now and you say, you know what, I should have applied 6 months ago, you can say, give me my 6 months back. They can give you 6 months back, but it will reduce your benefit because anytime you're right now, you're at the delay stage. So your benefits will continue to increase every month until you hit your full retirement age. It's called the delayed retirement credits. So delayed retirement credits is 8% per year. Your benefits will increase. So if your full benefit amount at 67 is $1,000 and you don't start those benefits until the month you turn 70, that's 8% times 3 years. So your benefit amount will be $1,240. So yeah, every month you wait, your benefits will go up. Yep. Okay, yeah. So I already answered that one. Let's see. Where can I submit a question? Well, right where you just submitted it. I'm retired in the Philippines. I married a 17-year-old Filipino over 2 years. I am 69. Can she receive a spouse benefit in the Philippines? Is the nation qualified for spouse benefits? Each country has, so you can go online and let me see what the actual title is. It's the overseas. Gosh, what happened to my thingy there? Yeah, it's a tool that the Social Security has online that each country has it's called a totalization agreement with the United States. So in some countries they recognize it, and there's different requirements for spouses and living overseas and all the rest of it. It's kind of living over the seas payment tool, but you can go online and just type it in the Philippines. Or probably the best is to reach out to the federal benefits unit in Manila there and file for benefits. Sometimes, and it depends on the particular country. Sometimes in spouse benefits you can or you cannot. Sometimes it's different for surviving spouse benefits. And sometimes it's like, yes, you can file it, but you have to return to the United States every 6 months or so. It really depends on the totalization agreement with that particular country. So the experts on the totalization agreement are in the federal benefits unit in Manila and the embassy there. Used to know the guy there, but he has since moved on to another place. So let's see here. Another question. Okay, I already answered that one. So my adult disabled son will have $1,000 per month they stole when my offset reverse be refunded. Okay, I'm not sure. Not sure about all that. I turned 67 in February 2025. I will retire in March. Can and should I start in January or wait until March? It really depends on you. It Because you're your full retirement age next year in February, you can earn $62,000 in January and still collect benefits. So you can start benefits in January, February, March, whatever's good for you. Every month you wait, it increases a little bit, but if you get it early, then you get that extra check. And remember, if you start your benefits in February, your check won't come until March. Social Security always pays essentially a month late. So your February check comes in March, March check comes in April. So how can I find out when you have live chats? Well, I've done live chats pretty much every day. I'm a glutton for punishment. Every day at this time for months and months and months. I think I'll miss Christmas, but other than that, yep. I'm a real victim after paying Washington workers' comp and Social Security for 35 years before I got hurt one too many times at work. Um, in terms of, workers' comp, and public disability benefits, those are the only things that offset if you're receiving disability benefits. then that offsets Social Security disability benefits. But any other type of long-term disability or anything like that does not affect Social Security at all. Um, Even if they raise the FICA cap to $500,000, that would make a significant contribution. Yes, I agree. Um, and even though I had, President-elect Trump in that picture there, he- if he jumps on board, then we're done. But I'm not blaming him or Biden or previous Trump or Bush or previous Bush or Clinton or Obama. I'm blaming all of them and all of Congress. They should have fixed Social Security. They had decades. They knew that the cuts were coming and they refused to do anything, or they were too incompetent to get it done. So there's that. Why is Warren Buffett collecting Social Security? Yeah, again, yeah. So that's one of the arguments is that means testing Social Security, and I would argue here's again, people say, well, if you raise the FICA cap, then the people that make not $10,000 but make $1 million a month, then their benefit amount is going to be $340,000 a month. So that's going to defeat the whole purpose. No, it's easy. You add another bin point. So you got a bin point of 90%, 32%, 15%. So anything over $100,000 a month, the bin point is 0.000001%. And then, we name a dog park after you or something, says, give you a trophy. So I don't know. Where's my sarcasm alert? Anyway. All right. Let's get to other questions. Please answer this, doctor. At annual financial cap, is there not a fixed FICA payment requirement? Yeah, I'm not exactly sure what that. If FICA cap is raised, what percentage would those higher earners receive? Oh, okay. I already answered your question there. So I'm in the bubble for Social Security Fairness Act. I worked for 16 years in a state university system, the highest 16, but I knew I was paying into a pension. If it passes, will I benefit and will it be automatic? Yeah, it really depends on the details of exactly. So it's going to pass the how if it passes the Senate, how all laws and everything. If it passes the Senate, and if there's any changes in the Senate, then they'll have to go back to the House. And it's interesting. This is a coincidence. The person that introduced the Social Security Fairness Act was a House of Representatives from Louisiana. The guy that's trying to introduce the Privatization Act is from Louisiana. The other senator that accomplished this new internet myth that 6.2 million people are receiving Social Security benefits is a senator from Louisiana. So I'm not cynical. I'm not conspiratorial, but yeah, I think something is going as Louisiana to get rid of Social Security. But anyway, all right. All right. Let's see here. Oh, Eli, thank you for the donation, the support. I appreciate it. All right. For anyone who went over on earnings, you can appeal and get the overpayment taken over time to make it easier. Yes, yes, yes. Yeah, that's what Anderson Cooper did. So you can, if you disagree with the overpayment, there's a couple of ways to do it. Social Security should really streamline this. You can do an SSA 561, which is a request for reconsideration, where you say, "Hey, reconsider this," or you can ask them to waiver it. Most employees don't understand the difference between the two, and it's difficult to understand it. But there's also an SSA 632 where you can ask them to waive it. Or if you say, yeah, I did go over the annual earnings limit, yada, 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 then you just go ahead and set up a payment plan. It's very, very easy now. And remember, it's interest free. So it's interest free. Let's see. Maybe once. Maybe they want to simplify Social Security for the 3% to reduce the work life for Social Security and OPM. Um, no, it's actually more difficult to administer because of that, windfall elimination. You have to report your earnings and all this other kind of stuff. So if they actually did it the way I suggest, they can get a programmer to probably write up a code in about an hour or so, and then we're done. So Ed, off topic. There's nothing off topic here. Does Medicare notify Social Security when a person gets a new Medicare number? Um, well, you get a new Medicare number through Social Security. You apply through, you apply for Medicare Part A and Part B through Social Security, and then Social Security sends it to Medicare, and then Medicare sends you the number. But yeah, so those two computer systems talk to each other. So, and if you need a replacement Medicare card, you can call Social Security, and they can do, and you actually do that online. So, they're pushing to online type stuff because they're at the lowest staffing in 50 years. Um, all right, Sarge, don't just talk to this YouTube idiot. How do we talk to politicians and Trump? Yes, I'm 62. I cannot get a VA times. I was in enlisted LPO. I never was a sick bay commando. A sick bay commando. Yes. Um, yeah, the petition. Sign the petition to raise the cap. Sign the petition to not privatize. Sign the petition to support Social Security so they can provide the support you need to get your benefits. So I can go back into retirement. So I don't have to keep doing these videos, which I'm not. I don't mind. I'm going to keep doing them for years to come. I'll just pick another topic once you're able to pick up the phone and Social Security gives you correct information and in a timely manner, then I'll figure something else to talk about. So anyway, so there's that. So, all right, we are over an hour and we are out of time. I apologize, but I will be back again tomorrow and we'll talk about the perhaps the culmination, hopefully not, of the 40 plus year plan to destroy Social Security. So make sure you join me tomorrow and we'll talk to you then. You all have a great night. Make sure you look out for each other.